Hi everyone, thank you for joining us. My name is Kath McIntyre and I'm from the Australian Telehealth Society, and the Society has been around since 2008 to build a community and a united voice around everything telehealth. And this morning we're in conversation with one of the presenters at the Success and Failures in Telehealth conference. But first off, I'd like to acknowledge the traditional owners of the land on which we meet today, and that we recognise their continuing connection with the land, waters and culture. And I pay my respects to their elders past, present and emerging. This morning, we are joined by Sharon Gannon, who is on the Australian Telehealth Society Committee. Sharon is an experienced and practical registered nurse and owner-director of Sharon Gannon Solutions. She has extensive experience in telehealth in the public, private health services sector and in government. Welcome, Sharon.
Thank you very much.
Today we're going to be talking to Linda Cuskelly. Linda has 22 years experience in health and is currently the program director at Metro North Health Service. She's been there since 2013 to promote, implement and scale telehealth. And Linda presented at the Success and Failures Telehealth Conference last year. So we thought it'd be a really good idea to get an update on what Linda has been doing with the fantastic work that she presented last year. So I will hand it over to you, Sharon.
Thanks, Kath. Well, thank you, Linda, for attending this little meeting this morning. Really great to be able to speak with you. What I'd like to understand is a little bit about what you did present last year in November at the Brisbane meeting, and then we'll talk about other things after that. So what did you present?
Basically, I presented on the strategies to support the Telehealth Virtual Clinic Uplift. So the Telehealth Virtual Clinic is a platform that sits on top of the PEXIP app, which enables a patient to connect to a telehealth virtual clinic and to be presented with a nice screen that welcomes them to the service area. This was implemented fairly quickly during COVID-19, so we were very much rushing to get services onboarded so that we could offer virtual care services because of the hospital closures, hospital avoidance, and needing to still see patients in the community. So we did, Kayla, I worked with my colleague Kayla, who's the telehealth facilitator. So there's the two of us that cover Metro North. So we do not look after the Royal Brisbane Hospital. There are a team of two there, but we look after the 5 hospitals, 17 community centres, Woodford Correctional Centre, Virtual ED, and other areas associated with Metro North. So what we did is we need to get services implemented quickly. So to me, engagement is everything. Communication is so important, but also using human factor principles, and that is to go virtual so that we could cover a big area. We are the smallest, if you're looking at the map, we're the smallest HHS in Queensland, but we're actually the busiest. So we had a lot of work to do. Yeah, so we used human factor principles and applied those so that we could virtually show our clinicians and other staff what the Telehealth Virtual Clinic was all about. So we provided a Telehealth Virtual Clinic overview and then a live demonstration where we would invite one of those people into the room on their phone so they can see how it looked for the patients. And that really played an important part, because then the clinicians were like, oh, it's not as bad as I thought. So it was good to do that.
Yeah, so that human factor really model really helped you with the implementation, I gather. Yes, excellent.
Yes. And I had some really good feedback from the clinicians around that, that they felt comfortable, because we not only did that with that human factor principles, we also had a follow-up training session. We did simulation sessions for those larger clinics, and then we gave them a suite of resources, which we sent to them, and they could keep in a Teams folder at the time, so that every staff member had eyes over this resource information. We have since done a internal intranet site, so we store all of those QRGs, those quick reference guides, within that platform. So we've done a lot of work there so that it's easy to access for all of staff.
Great, that's fabulous. So you talked about that at the conference, and did you enjoy going to the conference? Did you meet up? Have you had follow up with other people that you've met there?
Yes, I have, particularly other coordinators around the state too, because it's a chance to network, because during COVID we couldn't see each other, so we didn't have those face-to-face connections. But yes, it enabled me to meet other clinicians from other HHSs and have good conversations with them around what they do and how they provide telehealth, which I find to be very beneficial. It educates me on their perspective as well, because sometimes, you know, I know we're not all perfect and we can always improve. So it's good to get other people's perspective around how they deliver.
Good. Okay. And then what are you going to do this year? Are you presenting at the conference?
I am not presenting at the conference this year. I will actually be overseas myself. Yes. So, but what I have done from this initial work that I have done, as we have momentum, I am keeping with that momentum, and I am refreshing my PowerPoint continuously, so it's not boring, so that I really try to get, you know, people excited around providing telehealth. I'm reaching out to more networks, so the primary health care network, getting the message out, because there is confusion around what telehealth means in the community. And so we've got signs around that that we're putting into GP practices, and we have pop-up banners across all the facilities. If a hospital offers you a telehealth appointment, it means video call. So, you know, you will need to have a smart device or internet, and a smart device, PC or Mac, with working camera and audio. So we're trying to get that message out. So I try to, engagement is the key, I believe, communication, engagement, and trust, you know, building people's trust. And I think we have a really good reputation in Metro North around providing really good support for telehealth, and this is why we're doing so well. So from when we were at the conference, you know, we have improved, and we are continuing to do more telehealth services. So if we look at last year, 21-22, for the whole of the year, we did 60,485 occasions of service, just for outpatients only. For this year so far, between July financial year and April, we've done 71,653. So there's a growth of, you know, 46% there, and we continue to grow. So prior to COVID, we were sitting at around 2% in our outpatients for delivering video or telehealth services. We're now sustaining 6%, and we have been doing that for the last 4 months, staying on that 6%.
Right.
Actually, it might be 5 months, and 1 month we peaked at 7%, and this is when we didn't have a closure. So I'm really excited about those, you know, stats, and it does help when I'm talking to clinicians on the ground around who else is doing it, and offering the clinicians to talk to somebody from their own specialty around how telehealth works, and for a clinician to showcase that. So we reach out to people already providing it as our clinical champions.
Great, that's fantastic. Isn't it good that you can collect all that data and you've got that evidence? And that's the thing about telehealth, is that there's those systems that we have enable us to do that, and we can demonstrate the need. We can share that with our co-clinicians or our funders, and then we have that that ability to get some extra backup from the data. That's fantastic. Really good.
Yeah.
Okay.
Yeah.
Okay.
So I also pull in where I work in health excellence and innovation, we have all of our clinical streams that work within the unit that I sit in. So I'm very well placed to reach out to all the different streams, surgery, medicine, outpatients, you know, heart and lung, and children. So I'm in a good position where I actually sit within Metro North Health. So that has been very good to me, because I get their support from the nursing directors and the program directors across Metro North, which is great.
Well, you're clearly demonstrating that the rise of telehealth and the use of virtual care is, you know, really being supported by others, but helping all the other sectors of the health service. So that's good. And consumers, of course, we know are beginning to love it. Are you doing the evaluation of consumers' feedback?
Yes, so we've had a 12-month project going with Metro North, the co-design, Telehealth co-design project, and the recommendations are to be published from that project. So, but we've already started. I was introduced to a lovely consumer, Sue, who lives in an independent living residential aged care facility, but not in high care. So it's independent living, but it has high care section, and then there are 400 residents that are in the rest of the section. So it's a big facility. So we've reached out to Sue. We've got all the fridge magnets, 400 fridge magnets we have delivered to her for our virtual ED. So we have a virtual ED in Metro North that covers all of Queensland, Northern New South Wales, and Norfolk Island. So what we are doing is I'm meeting with the team next week to see if we can set up a hub within that facility, because there are so many residents, and to enable residents who are not technically savvy to be able to go down and be supported by staff for their outpatient appointments, for virtual ED, and other services, and also connecting to their doctors, etc., because we really want to promote the use of video conferencing, you know, telehealth, not telephone, because, you know, to me, for quality and safety, when you're seeing the patient, you're able to hold up medication, do the medication checks, see them walk. There's all those benefits with video, and that's why I'm so passionate about telehealth, because it does enable people. It enables our consumers for the doctors to come into their home, rather than them having to travel, paying exorbitant parking fees. You know, you sometimes spend $10 on a sandwich. So it is quite, you know, it's a day out. For a 15-minute appointment, 30-minute appointment, it can take somebody a full day that they have to rearrange for one appointment. So if we can, and if it's clinically viable, to be able to get the doctor into the patient's home, or, you know, we have a lot of nursing clinics and allied health clinics. So, you know, that even that multidisciplinary meeting where you can have many people coming in from different locations, it's something that we really promote in Metro North. And also for flexibility for our clinicians around, you know, they might not be sick, but they might have to stay home as they have children who are unwell. They can still provide a clinic, because for the so the sites that don't have direct entry into ESM, which is our outpatient scheduling system, or IEMR, which is the patient's medical record, electronic medical record, for those places that are still on paper chart, they can use the telehealth progress note. It's an interactive form which they do from their home. So if they have access to My Apps or Follow Me desktop, they have access to all the clinical applications, or they have a Queensland Health computer with VPN access. They can just provide the clinic at home. So it stops the reschedule of all those patients or the cancellation of clinics. So
that's fantastic, Linda. That's really, really exciting. Really good news. All right. Okay. So Kath, have you got anything you want to add in here?
Hello, here I am. No, I think that's great. That's been a great conversation, and I think it's really important to do these updates. So thank you so much, Linda. You know, it helps educate and share the knowledge between our community. So thanks so much for doing this. And if anybody is interested in finding out more about the Australian Telehealth Society, they can go to aths.org.au, or if you would like to come along to the Success and Failures Conference this year, you can also find out more information at the ATHS website. Thank you, Sharon, and thank you, Linda. Keep up the fantastic work, and thank you for your time this morning.
Thank you, ladies.
Okay, bye now. Bye.
Bye-bye.